Hi, everyone, and welcome to the Thursday practitioner call. It's 9 a.m. in the morning. This is always one of my most favorite calls of the week, as it is for practitioners, but also for their clients. And we have doctors always talking on this call, as well as other practitioners come in and share their experiences for themselves and their clients. And the last 10 minutes, we always talk about how a practitioner can set up their offices in order to get the LifeWave technology to their patients. So with that, it all starts with about 2018 when David Schmidt, the owner, inventor, and CEO, created the X39 stem cell activation patch. And he's actually been around since 2005, the owner, and he actually started making these technologies way back then. Actually, when the Navy SEALs asked him to make something to help the guys stay up at night without stimulants. And so that was the beginning of the company. And the company was doing about 30 million a year for the last 18 years. And then once again, in 2018, the X39 came out. And I believe it was the perfect timing. It was the combination of stem cell activation, which this patch does, and wearable light therapy, like light as a healing, or not a healing, but light as a way to help the body, or as a way to support the body, was being accepted, right? So we went from pharmaceuticals to supplements to whole natural food and juices. And then there was this thing called light, like that's actually something that supports our body. Well, yes, if you think about the sun, you go out in the sun, you actually reflect light and create vitamin D. So that's truth, but we just weren't really thinking it. And then all of a sudden, practitioners started bringing in things like laser therapy, red light therapy, red light sauna, blue light. All of a sudden, all these light modalities, cold laser, started coming out, and people realized that light was affecting the body. And so that's when this came out, and it is a form of wearable light technology. And yeah, it looks like a Band-Aid, but when you open it up, inside there is this organic material. It is organic crystal, and it reflects back your own light. Yes, we have light coming off our bodies, turns out, low-grade infrared light. And when you put this patch on, you just stick it on. Can you imagine a supportive product that you just stick on your body? Like, you don't have to swallow big pills, digest it in your colon. It just comes right there, and it moves light in and out of your body to make change in your body. And that is what this technology is. This came out in 2018, and it is light that activates a peptide, GHK copper peptide. And that peptide talks to your stem cells to tell your stem cells to start working again. And the patch has helped so many people over the last 3 years that the company went from 30 million all the way to $450 million. Can you believe that? Something is going on here. So Dr. Patty is an MD out of San Clemente, and I'm going to let her tell you a little bit about her credentials and how she became a doctor. And then, Patty, I want you to, from a doctor perspective, tell us about light, about photobiomodulation. Like, what is this thing called light, and why are practitioners, and what's the best word? Why are they interested in it now?
Great. Well, it's good to see everybody. And I was a music teacher in the first part of my life. I went to medical school midlife because I had a bunch of chronic stuff, and seemed like just about everybody I knew did too. And we were all having trouble trying to get it solved through Western medicine, typical Western medicine, which does many things well. But in this case, we're having some issues. So I went to medical school to sort of get the credentials, but I then continued to do lots of study beyond that in areas of homeopathy and in areas of Ayurvedic medicine and holistic medicine, just in general. Chinese herbal medicine because I felt like that there were many different tools I wanted to put in my tool belt besides just Western medicine. And so I'm here today because of one of my patients who was having some issues with pain in her jaw from dental work. And she began to tell me about the Icewave and the X39 stem cell patch. And I thought, I'm not sure about all of that, but she was so eager in telling me and having so much benefit that I did begin to check into it. And I found out how many studies there are, 70, 80 studies now. I loved David Schmidt. I just immersed myself in his beautiful YouTube, webinars, and it was great. So I'm so happy to be here. And I think one of the reasons to answer Marci's question that we like as practitioners, we're so interested in this photobiomodulation is because there's no drugs in this patch right here that I'm wearing. And it simply is utilizing an energy my own body has and harnessing that energy to help me to be more well. And I just love that because basically you're not going to have side effects. And again, I'm not diagnosing or treating anyone on this call because I'm just sharing my story. But my story is that it's been phenomenal for me. And the fact that we can have something that works so well with so many case studies and research for our patients, so little side effects and so much benefit. It makes great sense to me.
Wow. And I think that's interesting. I say photobiomodulation really fast, but you just broke it down, like what that really means. Photobiomodulation, which means light making change in your bio in your body, I suppose, right? Through modulating it. Is that right?
Right, exactly.
Biology of your body, probably the biology. That's probably the bigger word, huh, doctor?
Right, and we use light in our body, to synthesize. That's the synthesis part, meaning to create and to change, transform as needed. And we know we do that through vitamin D, right? We go out in the sun and our body converts that light into something beneficial for every cell of our body. And so it's the same thing here. We're actually synthesizing and stimulating more stem cells and peptide pathways and energy meridians using that energy and harnessing it.
Wow, I like that. Harness the energy of light to synthesize effect in your body. I mean, it's kind of beautiful. We've had the sun around forever, right?
Right.
And yet we didn't really understand its power until recently, like really what light is doing for us. Did you know, Dr. Patty, and maybe you could tell me a little bit about this. I just wanted to get in light a little bit because we talk so much about stem cell activation, and we'll get there in a minute, but I just wanted to step back to really let it sink into us, the power of light, like what this really means for our bodies and our cells. Explain how light moves through the body versus like a pharmaceutical or a supplement. Like, it would seem to me like you have to break all of the material things down. Explain the efficiency of light versus supplements or pharmaceuticals or even food for that matter. What's the difference?
Right. Well, for example, with sun, we need UVB rays from the sun in order to make vitamin D in our bodies. In our own body, we're actually pushing out all the time what we call infrared light. And that is a particular frequency. It's a very healing frequency. You've probably heard of gems that are using infrared light beds. There are little infrared light sort of beds you can hang over your door and stand by. You may have seen some of those being sold. A physical therapist may use an infrared wand because that frequency is very healing. And so when we push that out of our bodies, normally we put a patch on one special energy place that has been determined and studied. Often for us, we do that. It pushes that infrared light back into our own body to stimulate even more the pathways that we have in our bodies, peptide, stem cells, pain, whatever. And so
Wow.
that's what makes it so special.
So I didn't really understand that. So our body pushes out infrared, which is healing, but it's pushing it away from us. So this patch takes the infrared and reflects it back into us and says, no, we're gonna heal you with your own light.
Right.
Oh.
When we're actually just sort of always, making more, pushing out, making more, pushing out. It's all about the whole environment and how we interact with it. Yeah.
Well, and what do you think about this? I've always thought that, let me give you an example. We'll explain all the technology in a minute, but I used to take a glutathione supplement as an example, a pill supplement. And now there is a glutathione patch, which now that I understand it is using my own infrared light, redirecting it back to me to produce my own glutathione. So what I think is interesting, doctor, is that when I was taking the pill, it didn't ever seem to be as efficient. It didn't pull. I have huge bacteria issues. It never pulled the bacteria out. I mean, it did nothing. And I think it's because it spent so much time getting digested in my stomach acids and tried to get to my colon to make an effect, because colon absorbs, but there was probably really very little glutathione in that pill because it went through the whole process that your body does to break down a material. And I don't think I think with light, it just goes right into the bloodstream and you're good to go. Is that correct? Am I right on that?
Right. So we're just activating our own body's glutathione pathway. And you can do genetic testing on yourself. I've actually done that on me, and my glutathione pathway in my body doesn't work optimally. And many people's don't. And that's one of our big detoxers in our body. And so it makes perfect sense. I have never been able to even really take any form of glutathione, the glutathione that I take in, just exactly like what Marci said. It's never well digested in your system. You lose a lot of it. Some of it isn't even in a good form that's ever going to be bioavailable for you. In this case, when I found out about glutathione, just being stimulated in my body, I knew that is what I needed. And any of the other glutathione, it would give me side effects. I'd get very weak. I wouldn't feel well. I'd get a headache and so on. So I love this patch, and I've had to go very slow with the glutathione patch myself. But as I've done that, I've stimulated my own body to begin to have that pathway to work more optimally for me. So it's really been a game changer.
So let's go back to X39, because we haven't really talked about the mechanism on this yet. We've talked a lot about light. So this is the X39. It activates through, we know now, reflecting back your own infrared light into your own body, a form of photobiomodulation, which is a form of photo light therapy. And this patch actually activates a peptide called GHK copper peptide in your body. And it's that peptide that activates your stem cells. Talk to us a little bit about that whole mechanism. Why is this important? What is this GHK and this thing called stem cell activation that this patch does, doctor?
So in my own holistic integrative practice, we have been and still do use some injectable GHK copper peptide. Peptide is just a short chain of amino acids, and very naturally in our body, we have these pathways, we use them, we utilize peptides, and they can be very helpful in almost sort of like turning back the clock, regenerative, reparative, helping you sleep better, helping tissue repair. And so injectables can be very effective with peptides, but you have to inject them, and they're much more expensive than the patches. And then you are still injecting a peptide into your body. Maybe you can't use all of that, or you're underutilizing a dose for yourself. when you use the patch, you take care of that because you're stimulating your body to do its work in its best way.
Wow. And so let's talk a little bit about, we activate stem cells. So this patch, this X39, remember, it looks like a Band-Aid. Just by putting this on your body, you can put it anywhere. Most people wear it right below the back of their neck or under their belly button, but any spot will do. I just threw it right on my hand here. It activates your stem cells, makes more stem cells, and resets your stem cells to a younger, healthier state. Let me say that one more time. This product activates your own stem cells, creates more stem cells, and resets them to a younger, healthier state. Doctor, why is that important?
Well, as we get older, we don't have as many stem cells. And we know that our body doesn't repair our DNA as well. That's why younger people, for the most part, don't have cancer. Older people do. We want to have optimal stem cell working and optimal stem cells in our body. But as we age, we have less and less stem cells, and they don't work as well. This X39 stem cell patch, our stem cells are activated. They produce so many beautiful growth factors and healing repair mechanisms. So we want to have as many stem cells as we can, and we want them to be working as well and optimally as possible. And that's what this patch does for us. It helps us to stimulate more stem cells in our own body.
So what is the role of stem cells? Why is having young stem cells or even stem cells at all important? Like, what do they do?
So you probably you've heard about embryonic stem cells and all the controversy around that. That's not what we're talking about. And when there's a baby in the womb, and by the way, I'm a brand new grandmother. I have a little granddaughter right now that was born a couple of days ago. And so you look and you see how beautiful their skin is and how gorgeous they are, right? And so in her body, as she was developing in the womb, she had many different kinds of stem cells that could actually make ears and head and fingers and heart and so on. But as we're born then, and we enter into this world, we begin to have what we call mesenchymal stem cells. And those stem cells can't convert, I can't make another head right now, but what I can do is help regenerate my body in many areas. And so those stem cells, Marci and I've talked about, they're like honing birds that can go to areas of your greatest inflammation, which is what X39 helps to do for us.
So when you say they're honing birds and they can't make another head, that's what stem cells do in the womb, which, by the way, just think about that. Stem cells are responsible to develop a baby's ears and heart and lungs. Like they can change. They're changeable. They can change into whatever cell your body needs. And so when it's a baby, your body needs ears, it needs a heart. I mean, it's kind of a miracle, really, how this whole thing works. So then they move into a different type of stem cell. I'm sorry, that was a big word, doctor. What's the kind of stem cell we have now?
The kind that we have are called mesenchymal stem cells. And those are the ones that, we don't make another head, but we can regenerate tissue, and we can have good DNA repair and many restorative things that come from those stem cells, growth factors and anti-inflammatory products and so on.
So what that means is that these stem cells, if I understand this right, Dr. Patty says acts as honing birds, and they're I cannot pronounce that word. Somebody put that word in chat. That's a big word. And I want us all to be able to say that 3 times really fast, because that's no joke, that word. So those particulars, there it is, mesenchymal.
Mesenchymal.
Mesenchymal. I'm a little dyslexic. Do you have a stem cell for that? Okay, so those stem cells have the unique ability to change into whatever cell your body needs for repair. Let me say that one more time. These stem cells that Dr. Patty's talking about have the unique ability to change into whatever cell your body needs for repair. So they're reparative now, right? She said they go for tissue repair. They search. So I see it kind of like I'm a layman, but I kind of see it like this army in your body, and it gets activated by GHK copper peptide. It was like maybe dormant, like I'm 55. My stem cells pretty much were all on vacation, right? They're not dead. They're just dormant, right? And I see this patch basically activating the GHK copper peptide, and that peptide, like the telephone to the dormant stem cells, saying, hey, wake up. It's time to get marching. It's time to go repairing. And I see those cells marching through the body, looking for those inflammatory spots, inflammation, and then repairing wherever that is. So let's say it goes and fixes the knee tissue, and then it goes and moves up to the lower back. And for me, it went and pulled all that bacteria out with glutathione, right? It moves to where you need it. I don't know what your body needs, but the beautiful thing is that your body knows what you need. And the stem cell then redirects the stem cell activation patch then is turning on that army again of stem cells and directing it to the greatest need first. That's why sometimes you don't always feel it within the first 5 days, even 30 days. David says you need 1 month, which is 30-day supply for every decade you are old. And that is really how the patch starts to work. It's going to go first to what you need to live, and then it's going to get to what you feel. So please know that this may take time. On Start X39 Now, that's startx39now.com. If you are a practitioner and a client of a practitioner, go to that site today and do some research. There's a couple things that you should look at. The patent, the research and patent. We have a 20-year patent that says, yes, X39 activates your stem cells. David Schmidt, the owner, inventor, and CEO of this company, has an 18-minute video. It's video number 3. And it talks about how the light technology works, and how the stem cell activation works, and then the issues this patch helps with. It's so good. And lastly, go down the page a little bit and hit what to expect in 12 months. Basically, the first days to month is sleeping better, more energy, more joy. After that comes like a recalibration of the brain. After that comes the cells starting to make change throughout your body in repair. And then comes, after about 6 to 12 months, there's a study that David did that shows that 14 out of 15 people, after being on the X39 for 6 months, as measured by blood, reverse their age by 8 years. So literally, when you put new stem cells on old tissue, you turn the tissue young again. Okay, let me say that one more time, because this kind of blows us away. When you put young stem cells on old tissue, you turn the tissue young again. We're not just anti-aging, which is like protecting from age. We're actually age reversing. And I don't know about you guys, but any of you that have been on these Zooms for anywhere from 1 to 3 years with us, we've been seeing it in our own skin, right? It's like the clock is reversing a bit. And that's a great side effect, right? Dr. Patty, what do you think about all that?
Yeah, I think it's pretty cool. What's very interesting is initially I had heard several webinars of people talking about that their hair that was gray was turning more back to dark colors, or whatever their natural color was. And I thought, that is really too far out for me to think about. But I have to tell you something. So my husband and I have been doing X39, 49, and we do some supporting patches too, but we've been doing particularly X39 and 49 since the 1st of May, and about the first week of May. And I cut his hair, and I also color it when I cut it. And I always add just a little bit of color because I like his, gray that he has. But I told him a few weeks ago, I said, because, and I let we let it grow for a while. I don't do it, but maybe every couple of months or maybe 6 weeks. I mean, literally, that's how infrequently we do it. And I told him, I'd say it was maybe about 3 weeks ago or so, something about that. I said, your hair doesn't really look like it's needing to be colored. And I said, I honestly don't think you have so much gray hair, especially all around the temples and everything. And he said, well, I was sort of noticing that too, but I think it just hasn't been that long since we did it. And I said, I don't know about that. So anyway, I finally, it got so long that he wanted it cut. And I said, but honey, really, you've got a lot of dark hair. You still have some gray, but not very much. And I said, I'm telling you, I think you're one of these men that I'd heard that maybe your hair is coming back to its old color. So anyway, just sort of something very interesting, but very observable. And it's stunning
I'll
to
tell
me.
you this, Patty, I want a before and after picture of your husband. That's what I want.
Well, I know, actually, I will do that. That's a very good idea, because it's, we're just sort of thinking, okay, we'll see about this, but wait a minute, it is different.
It's pretty cute. We always say a picture says 1,000 words, and so know that there is a Telegram site that you can join, which is our before and after pictures. And Patty, you could actually put that picture right up there yourself. You could put your own before and after pictures of anything up there now. And it can be of your face, or people put like different injuries that have healed. I mean, the stuff on there is crazy. But you go to Start X39 Biz, that's startx39biz.com, under the 14 steps of success. You click that button, and then you click tab 5, join Telegram. And there's 5 different Telegrams that you can join. One of them is the before after pictures, and you click the link to join, and you can see all the before after pictures, and you can add your own before after picture in there. Now, if you've never joined Telegram before, make sure you click the link at the very top to join Telegram first, and then come back and click the link for the before and after picture, because it's really, really cool. So thank you, Dr. Patty. What a great story. We did not know about your husband's beautiful hair. That's wonderful. So how do you wear this patch? Well, you wear it 12 hours on to activate and repair, and 12 hours off. 12 hours on to activate and repair, and 12 hours off. You can wear it right below the back of the neck, under the belly button, but really any spot will do. As Dr. Patty says, our whole body pushes off this healing infrared light, or maybe a better word would be this protective infrared light, the supportive infrared light that comes off our bodies. So the reason it's 12 hours on and 12 hours off is because we are light. Remember, we are non-transdermal. There is nothing in this patch. This is organic crystal. There's not any medicine in this. This is a crystal, which is reflective, right? Crystals reflect. And so that's what's in this patch, right? And so the reason you need to go 12 hours on and 12 hours off is because if you wore it 24 hours at a time over and over and over again, your body would get used to the signal and it wouldn't work so well. So there's only one rule: 12 hours on, 12 hours off. So Dr. Patty, let's move on to one of our supportive patches. Let's talk about some other patches. What patch do you want to talk about next? You pick and I will show. We'll do some show and tell today, Doctor.
Well, my favorite probably supporting patch is the Icewave. And that's how my patient got my attention initially, because I do have chronic pain at night. And so I thought, I didn't want to take any medicine. All the other, pain medicine we know is notoriously either addictive, or it causes you to be constipated, or it makes you sleepy during the day. I didn't want any of that stuff. So I just was dealing with it. But I thought, well, Icewave sounds like a great idea. I can't believe there's nothing in there as far as a medication. And so I can't imagine it could really work, right? That's the way the Western medicine doctor in me thinks. But I tried it. And the first night I had about a 50% reduction in my pain. And again, it's like awesome. And so I tweaked around a little bit. There are many different suggested protocols on the website for whole body pain. And within the third night, I was about 80 to 90%. And that has sustained itself. You know, as soon as I got that point, I thought, well, it probably won't last. And it did. And so I'm very, very pleased. And last night, I was actually having a little more hip pain than I normally do. So I got 2 more patches out. I put the white one on my right hip, the left one on, and the brown one on my left hip. And literally within, I mean, honestly, it must have been maybe 5 seconds, I felt that pain. I mean, I didn't feel that pain anymore. I went back to sleep and I slept. And
Okay, so
so
wait a minute.
very
So-
incredible. Incredible.
So let's talk about that again. How many Icewaves do you wear? And then when you had a break, because people ask me this all the time on Icewave. Boy, it worked for a while, and then I had breakthrough pain, and I don't know what to do now. So, so first of all, what did you do to get 50% pain-free? What did you do to get 80% pain-free? And where were you at when you had some breakaway pain, and what did you do? Just take us through your actual placements. And by the way, this is what she's talking about. This is Icewave. Like, David has been around since 2005. So he's been making technology before we understood what it was, right? So 2018, X39 came out, and that's really what we all took notice of. But then we're like, wait, look at all these other technologies he's been making for the last 20 years. What are these? And so this would be Icewave. Icewave, it takes pain away. Now, it doesn't repair. X39 repairs, so eventually pain won't come back. You get that? But Icewave will take the pain away as the X39 is repairing. You put the brown patch on your pain spot. Well, where do I hurt the most? Oh, that shoulder hurts. Put it right where it hurts. The white patch about 3 inches away. And it breaks the connection of pain. It breaks the connection of pain. That is because it is, it's like, Icewave's like, have you ever anybody had to charge a battery before in your car? You know, when your car goes out and you got to put the positive charge and the negative charge on, and then all of a sudden your car turns on again. Well, we're kind of like a car, right? We got a negative charger and a positive charge, and then you turn it on and the pain goes away. And David says the pain is actually in the connective tissue. So we're basically breaking the pain in the connective tissue. Now, that would just be what I like to say is pop the spot. So if you had, like, for example, a really a shoulder that was hurting, you could put the brown patch right on the shoulder, the white patch 3 inches away, and you could put X39 there too. Pop the spot of pain is what I say. That works really great. But now Patty has symptoms of MS. And so she doesn't just have pain in the shoulder, right? She has full body pain. And I like how she explains something called block the pain, kind of like bookends. You know how you have books in your books, and you block, you have a bookend on one and a bookend in the other. Think of pain where you're blocking, like a bookend, your pain. Oh, I got a pain here and a pain all the way in my lower back. You could block that pain, or you could use more. It's okay. You can use more than one. You can use 2, you can use 3 sets if you have a lot of pain, right? So Patty, let's talk about how you block your pain full body with Icewave, and then what you did when you had some breakthrough pain.
Yeah, and think about it, pretty much all of us have heard of electrical stimulation. You may have used it yourself, or you know someone that has. You put these little pads on your pain spots in your body and you turn up the little bit of electrical stimulation, and that helps to diminish the pain. In a sense, that's what we're talking about. Our body is full of electrical impulses, and often in Western medicine, we only recognize that like with an EKG with the heart or an EEG with the brain. But Eastern medicine recognizes all of these in the body. And so that's what we're tying into with the patches. So when we bookend by putting one white patch, always white on the right, just remember white right, but I put one underneath my right foot, a white patch, and then a brown one underneath my left foot. Okay, and that's what one of the suggested things to do. And that's so you're bookending down there, and then you put a white up on your shoulder and a brown on your left shoulder. Right shoulder white, brown, left shoulder. And so you're bookending. I love what Marci says. I love that word. I'm going to keep using that now. But it, you can see from your feet to your shoulders. And so you have other places you can bookend. And one of my favorite places is putting it on the inside of my elbows. And that's another recommended spot. And that seems to pretty much bookend my pain even there. So I sort of alternate just a little bit, but shoulders or elbows are my best spots.
So one more time. So what I hear you saying is you kind of have pain, full body from your neck down to your feet. So you're bookending your pain with putting it under your feet, putting it on your shoulder. So that kind of bookends your shoulders to your feet. And when I say that, she's wearing 2 sets, right? She's wearing
that for whole body. They recommend the 2 sets. Yes.
She got the whole body. She just doesn't have a spot, right? So, be realistic with what your pain level is, right? If you've got symptoms of MS or symptoms of fibromyalgia, for example, you're probably going to need more than one. Okay.
Yes.
So, or she bookend her elbows, right? So do you ever wear, do you bookend 3? Do you ever go shoulders? This is head, shoulders, head. Remember that song? Head, shoulders, feet, and toes, or whatever. Okay. But do you ever do your shoulders? You know that song, Kathy. Quit laughing. Somebody remind me how to sing that song. Do you do your shoulders, your elbows, and your feet? Do you do 3 sometimes?
Well, last night I did my elbows, my hips, and my feet. So there are, just sort of several places that you can do. Their wrists are another place where you can put them. So part of the beauty of the patches, and I always tell my patients, medicine isn't just a science, it's an art. And so it's so great when we can actually use our knowledge as practitioners to individualize and customize with our patients. So you could do a little experimenting.
Okay, I just have to say Heidi got the song. Head, shoulders, knees and toes, knees and toes. So whenever you need to bookend, just remember head, shoulders, knees and toes, knees and toes. You'll remember that you can layer your body for your bookend your body. I don't know why life is so good. Okay, so so for you, when you had the breakaway pain, you actually used 3 spots versus 2. That's what I'm really hearing. Yes?
I did last night. Yes.
Interesting. And it got it.
It did.
That's amazing. So Dr. Patty, thank you for sharing Icewave. I want to give all of you the permission to use these patches in how it works for you and to practice, as doctor says, for your clients. If you have a client that's coming in with full body pain, understand how you can utilize the patches to really get at that, so to speak. Speaking of pain, I'd like to move to Nirvana, doctor, because Nirvana is interesting and we're on pain. So let's really wrap pain. What is Nirvana, and what is the Nirvana system, and what does that do for mood, and what does it do for pain?
So I've heard David talk about it a little bit for patients that have mild depression, and I have used this with a number of my patients. The Nirvana patch is sufficient. However, if you want a little quicker response, or patients that have a little more of the mild to a little more moderate depression, it's best to use the whole system. And the system includes oral pills, 2 that you take, along with the patch that you use each day.
And hold on, let me, so people can see on video.
Yeah.
So this is the Nirvana patch. And as you know, they're all the same, right? This is it. Just the way you know the difference is that behind it, it just says Nirvana, right? That's how you know you got a Nirvana on. And this is the pill. So this is the system. Okay, doctor, go ahead.
Right. And I've experimented with it myself and with patients to see, is it better to maybe use the patch at night and then maybe the pills in the morning, or vice versa. And I think, I don't think I have the answer to that. I think it just depends on the person. One of my very close friends is using it, and she's using it in the morning, the patch and the pills, and has found the best value for her with her mild depression. So I think it just depends. But I think the whole system is very good. And David says it will give many people, not everybody responds, but it will give many people good results within a month or 2 months. You want to give it just a little bit of time.
Yeah, so let's talk about that. 2 months for Nirvana, because what we're really doing with Nirvana is using light to modulate the neurotransmitters in your brain. So things like endorphins, serotonin, dopamine, the things that affect mood. Can you believe that? Is that amazing? My son, who has symptoms of OCD, loves Nirvana. I always know when he's in my office, when all the patches are right, I have to reset my patches every morning. And he just, before he goes to bed every night, man, because he's 24 and that's the only way he'll stay compliant, he just rolls them right on his forehead, and Nirvana's one of them, and to bed he goes. So let's talk about Nirvana as it relates to full body pain, because let's be honest, you can only wear Icewave 12 hours on, 12 hours off. Nirvana, you can only wear 12 hours on, 12 hours off. So people are always asking me, especially people with chronic pain, I'm good for 12 hours and then I have to take it off and I'm not good. So how can you rotate this system, and explain how Nirvana works versus Icewave, and how you can use that whole set for 24-hour relief of pain?
Well, so when you have the patch and the pills, you could use the patch at night, let's say, and the pills during the day. And so you get that coverage. Some people think it's a little better to do it all at one time. For the most part, what I found for me with Icewave, my pain is worse at night. And most people's pain is worse at night because our cortisol levels drop in order for our melatonin to come in and help us to sleep better. And so we know that you can, if you've got like a joint pain, often you go to a doctor and you get a cortisone injection. And I'm not a fan of those in particular, but sometimes that may be needed. And so what we know about that, cortisone is a synthetic cortisol. So at night, as your cortisol levels drop, that's when you may start itching more if you have itching issues, or you may develop hives at night, or you may have more pain. And so most people's pain is worse at night. So I would usually say to wear the patches, the Icewave at night. But I found that it seems to extend for me, even sometimes a second night. I've tried that to see if I could get by with not doing it a night. And sometimes I've been successful with that. Putting them on your feet, and I know anywhere in the body, sometimes you can have sweating and then the patch may fall off. And Karen, my sponsor, literally, and here with you guys, she's so amazing. And she told me from the beginning, she said, what you can do is you can just even put a little bit of medical grade tape across that to hold it on. But if you're using it on the bottom of your feet, often at night, then you're not going to have quite the problem of them wanting to fall off. So those are just some suggestions.
So explain about, isn't there a study that David did on the Nirvana system that explains after 6 weeks of taking Nirvana that it acts as a pain pill, basically, but it's not bad for you? What is that study? Can you tell me about that?
You know, I'd have to go back and look at that because it's been a while since I listened to him talk. So I don't have that in my head. I don't have that in my head. Someone else might.
So what I have heard on Nirvana, and there's you can always do deep dives with all of these protocols. And what you do is you can go to startx39now.com to the very bottom of the site under Lifewave YouTube channel. And you just click on that YouTube channel and you can search David Schmidt and any of these patches. David Schmidt Nirvana, David Schmidt Icewave, David Schmidt X39. And he does full hours on each of the technologies and really from a science perspective, how they work. But on Nirvana, he talks about after 6 weeks of Nirvana, Nirvana takes pain away from the brain. That by making the brain better, the brain takes the pain away. And where Icewave takes pain away in the connective tissue, Nirvana can take it away through stimulating the neurotransmitters in the brain to take the pain away. And you could research that study, but I know that there's some folks, Ted has a group of folks that have chronic pain, and they are working towards reducing their pain meds, right? Because they have chronic pain. And so what they do is they do Icewave at night and the Nirvana system during the day so that they can modulate this aggressive pain and lower their pain meds. That's kind of what I thought was pretty beautiful about incorporating this whole system together. And let's see here. Let's see if there's something on chat here. Incorporating that whole system together. The pills actually are made out of seaweed. So they hold the toxins until you can defecate them out. And then of course, Nirvana is stimulating the brain to stimulate those neurotransmitters for joy and happiness. So, oh, and what about addiction? Yes, Nirvana is the patch to help folks through symptoms of addiction, right? Nirvana really is the joyful patch, but it's the bliss patch that's good for you. You know what I mean? There's not addiction, there's not side effects, there's not anything that would be bad for you. It's just a natural happy or bliss. You know, I don't know, sometimes you would say the same way you may feel when you pray or meditate, right? That's how Nirvana feels to me. I hope I can make that. So it feels like that versus like, you know, other things. So, I mean, does it help people with addiction? It does. Yes, it does. It does help with symptoms of addiction. Absolutely, Stephen. Thank you for asking. Okay, so doctor, I have Aeon, Silent Night, and Energy that I still want to talk about. Which one do you want to talk about first?
Well, Aeon is the one that I include in the silver pack for my patients, for every silver pack, because it works in conjunction with the X39 and 49 to help quell inflammation. And so, you know, Marci and I mentioned before about the stem cells being like honing birds for inflammation. So the more inflammation that you can lessen in your body, then the more ability the stem cells have to continue to work to rejuvenate, not just repair, right? And so it makes sense to add Aeon because from everything that I've listened to when David talks, there's a synergistic effect there. So I do the X39, 49, and Aeon. I love Aeon. My husband uses it in the day and I use it at night because I think it really pairs well for me when I'm not doing the X39 or 49 at night, but I'm doing my Icewave and I'm helping with inflammation. Some people like to use the Aeon opposite the 39 and 49 so that they're getting inflammation coverage all the time. And others find that they like to put it all together to get good synergy.
You know, it's interesting you should say that because Aeon activates a peptide in your liver that reduces inflammation. And you heard Dr. Patty say, you know, stem cells go look to repair. And what's interesting is that inflammation, especially chronic inflammation, I think is the bad boy, right? It's like it goes and wants to eat the stem cells that are trying to repair. So if you can reduce inflammation, then you're going to turbocharge the X39 to work better. Did I get that right, doctor?
Yeah, I would say that turbocharge is a good word because I feel like that it has so much power. And that is something why I like Aeon. And I think that it also has just that calming effect too. And that's why I especially like it for me at night.
Yeah, tell me about that. You know, David talks about Aeon being the gentle giant. It's powerful. It's you know, I would say X39 and Aeon honestly are David's workhorses of the line. Like if you were going to say if you were going to just pick two, these would be your two that you would pick to start with, right? But why does he call Aeon a gentle giant? What is there something that Aeon does to the system?
Well, I don't honestly know any more mechanism beyond activating the peptide in the liver. But I do feel like that for me, I can even put Aeon on a spot on my body that hurts. And now there are specific sites that have been studied. So it's always important to really look at those and start with those sites first. But then you can experiment a little bit. And for like a knee problem, one of my family members would put Aeon in the middle of the knee and then put the Icewave on either side and got more effect with that too. So I think it has quite a bit of power in quelling inflammation to also help with pain. And that's another reason I use it at night to help perhaps get some of that benefit too.
I think too, for me, like I'm always my natural essence is of high energy, almost to the point of, I would say, mania, not horrible mania, but just a little below mania, right? And so Jan, don't laugh at me. And so what I find is that Aeon puts, especially at night, puts my system back at that rest and digest versus that that kind of fight or flight. Like, I guess that's what I mean. Like sometimes I can work so high that I get into that kind of fight and flight mechanism, even though there's nothing, there's no big bear chasing me, but I can easily get to that spot, right? And Aeon seems to take my whole system back down to rest and digest. What do you see? What do you think about that, Patty?
Yeah, I agree. And I have that too. You know, I tend to be very driven. I think many of us as practitioners, we care about our patients and we're working very hard. And I know sometimes if I put on Aeon a little bit right before I go to bed, I can feel just a general sense of relaxation. So, you know, we have our rest and digest, and then we have our fight and flight. And we don't want, most of us stay in fight and flight too much. We're always thinking we're running from a bear when often we're not. And so it's nice to be put into that gentle giant, that rest and digest. And I like that very much.
Me too. It's been so good for me. And yes, of course, we are not here to cure, treat, or diagnose any disease. We just are talking about how these patches can support our systems. So I love that. A better word would be living in fight or flight when there's no bear, and utilizing Aeon to take us back to rest and digest, which is a more calming place for your system to be. So doctor, what you said your other, I thought this was very interesting. She says for her clients, she does a silver kit. That's $2.99 with a 30-day money back guarantee, by the way. And she puts in that silver kit. Let's see if I got this right, doctor. X39, X49, Aeon. What's your other one that you put in? Icewave?
It can be Icewave, yes, or glutathione, sort of depending on the patient's greatest needs.
Glutathione. Okay, well, let's talk about this then. You just took me in a new direction because we
Oh,
got to
okay.
know why. If doctor's putting these 4 in the kit, I guess we better know why. So we already know why she puts Aeon and X39 in her kit for her patients. Why X49 in the kit? Why are you putting that in there for patients?
So most of my patients are very interested in maximizing performance, workouts at the gym, or just, feeling like they have enough energy to take a walk at night. They're interested in burning fat and moving it into muscle. And so some of the things that X49 does well are these areas of helping us to recover better from activity and not have such sore muscles and not have so much fatigue. And so I think for most patients, X39 is also our stem cell releasing patch, but it releases AHK copper. And so it's just one amino acid change from the GHK copper, alanine instead of glycine. So but it activates a different pathway in the body. And I figure if we can activate more stem cells and another peptide regenerative pathway in my body, that's what I want to do. So X39 and 49 together are stem cell and peptide stimulating patches. And then Aeon to help reduce inflammation. So 39 and 49 work better. And then the 4th patch, something specific for the patient. Some of my patients that have long COVID, we've been using Carnosine as that next patch. Some that really need to detox, which most of us do, glutathione. And so that's where we start picking that. And I figure that's enough for the patient for that time.
Wow. So so all your patients get like the base of X39 stem cell activation, Aeon for inflammation, X49 for lean muscle mass repair. By the way, X49 also supports the heart and the brain because it's supporting AHK peptide, which is in the muscles of the brain and the heart. That's kind of interesting. And a fun fact, it also shields you internally from cell phone radiation. So I think that X49 is pretty special. So that makes sense. And then did you hear she changes the 4th one based on what's going on with the client. If the client has detox and antioxidant issues, it's going to be glutathione because glutathione is your master detoxification system. So glutathione is the polar outer of all yuck, fungus, mold, virus, toxins, bacteria. That's glutathione. She said she also uses for people that need organ support. Let's say, I don't know if I think I might. Oh no, I'm not out. Carnosine. Carnosine is the supporter of every organ in the body. Liver, lungs, pancreas, spleen, kidneys, right? Protects organs. It also is a protector of your telomeres, which is an indication of longevity. So that's interesting to me, doctor. And then if they have a lot of pain, my guess is Icewave is the one. Did I do that right?
Yes, that's usually the way we go. And I do still have some patients that just want to start with X39. But more and more as we discuss it and talk about it, they find that they're very much interested in some of the other patches too.
So doctor, let's show now, and David has about 15 different patches, and I'm going to show you a couple sites before we end. This is for the practitioners that I know will want to do their research. So I'm going to show you where to go. If you want to write this down, the 2 sites that you'll want to check out are startx39now.com. That's startx39now.com. I'm going to show that site to you right now. And I'll just show you what you might want to go look at. So this is video 1. This is what doctor was talking about on light. Video 2 is a 3-minute video on stem cells. Here's where the patents and studies are. As you can see, David Schmidt is a researcher and he loves patents. So you can see all of the research he's done. You can just go look at all the studies. I mean, he's done research on every single patch that he has created. So there's plenty of research there for you. And then you can see the patent right here on X39, for example. It talks about what this patent is, which it says that X39 activates GHK in the blood, which stimulates stem cells. Once again, you can't get a patent if your technology doesn't work. So that's pretty amazing. Age reversing with GHK copper peptide. I love this. This talks about what the peptide does. This is why Dr. Patty's been injecting people with copper peptide for years, is because she knew what copper peptide does for skin and hair. It's the #1 molecule for metastatic colon cancer. I think that's pretty amazing. Lung protection, antioxidant protection, brain and nerve stem cell activation. So GHK is a pretty amazing peptide. This is the video 3, where David, you can hear our owner, inventor, and CEO talk about the technology, the light technology, and the issues it helps with. That would be that video. One of my favorite, oh, and this tells you places you can put X39. One of my favorite is what to expect. And this is what to expect in the first few days, that we reset 3,000 to 4,000 genes to a younger state, more energy and joy. This is where at 6 weeks, symptoms of brain start to reverse. This here, stem cells start to repair the body and then reverse aging within 12 months. This is really great. And then lastly, if you want, oh, this is great. We just added this. David Schmidt explains X39 with health practitioners. He goes through all the research on this video. You'll very much like that. And then you can take a deep dive by going on YouTube to listen to David. You can also click here for a quick reference. I know Dr. Patty prints off these for her office so she can make sure she's picking the correct protocol based on her client's needs. And so this is very nice. And then here is a very quick reference guide to each patch, how to wear them. And it's a nice research piece. Once again, this is where you would go YouTube, where you would search David and any of the patch technologies to get the hour explanations. That's the deep dive on YouTube. Next, I want to show you our Start X39 Biz site. This is where you would pull your forms to set up your office. And what you would do is you go down to the Be Activating System, the 14 steps to success. You click this, and then you have the steps, and just write down the tab. You would want to definitely go to tab number 9, right? Tab 9, take the order. And I'm going to show you Dr. Patty's favorite forms. She likes, and the reason we put these here is because she told me to. She likes the 1-page all product. It's right there. You can print it off. You can text the link to people. It's the database for printing or texting. She also likes very much the, hold on, give me a minute. The what to expect. So a lot of my offices print this out now to show their patients what to expect. This is new there on the site. And then, of course, they like the order form. And Dr. Patty likes the Silver Kit protocol form. That's her favorite, where did you see how she likes the X39, X49, Aeon, and Icewave for $2.99? We created this for her. And you can see the detox and brain she was talking about, the skincare, the sleep, the hormone and digestion. And then, of course, always one X39 the following month to keep your stem cells activated. And of course, these all have a 30-day money-back guarantee. We need to add that to the form. And then she also likes, for the patients that want more of a family protocol, the $4.99 protocol, which is just more patches at a better price. You get more for your money. So those are the 2 sheets she uses. So she has these printed out. She has her 1-pages printed out, and she has her her what to expects printed out. And Dr. Patty then learned how to put the orders in the system. She actually hired an assistant that does that for her. And the product goes to her clients. And then, of course, the company, Lifewave's like Amazon. It ships to people's homes and then pays you a thank you check for doing that work. That's really what it is. Jan Rand, if you are on the call, could you please put your name and number in chat? If you are new to this call and you don't know how to input orders, or you can get with the person that enrolled you here, or you can call Jan Rand and she'll help you. Jan works full time for me, and we are here just to be of service. We want everybody to know where the resources are and how to use the materials. So you're welcome to call Jan, and once again, her number will be on chat. And then the last piece that a lot of my doctors are loving is under tab 6. Write this down, tab 6, give a gift. And under give a gift is the business cards. And they look like this. It has the doctor's picture, the QR code to their website, and the QR code to startx39now.com. And then they basically use these business cards, and then they order through Jan this is called a gifting bag, but we call this, you could call it your practitioner bag. And it's a bag that has a little plastic, some envelopes, and this is what they use. It's kind of like a electronic business card and brochure in the office that explains the technology. And so you can call Jan Rand and she can get this set up for you, the practitioner bag. You can call Sally, who is our printer, and you can order your doctor business cards. There's the number for Sally, and all of this is in tab 6. And what I love about this is Dr. Lisa, and this is what she did. There she is, Dr. Lisa. See if I can show that to you. MD, she's a pain doctor. And then this right here, she puts one Icewave and one X39 in her practitioner bag with her card, and she'll pop the spot when the pain clients come in. And then during the appointment, because Icewave is so demonstrative, they are ready to have their silver or gold protocol. So she made 30 of these for her clients. She pops them in the office, and then she signs them on silver and gold protocols. So the difference between, I'm not sure if Dr. Patty is using that, but basically what most of my doctors have are the protocol order form. They have the one page of all the products. They have the what to expect form. And then they either have the envelopes that explain the technology that their clients can just read, or they have a pop bag with their business card with, if they want to share a sample, or they can sell that as well, but then they move everyone to the silver or gold protocol. So I hope that helps some of the clients understand where, or the practitioners, how to set up the office. And once again, Jan Rand, did you put your name? Jan Rand's number is 714-403-5325. She can help you practitioners know how to order she can help facilitate you through Sally, our printer, or how to order your practitioner bag, or what forms to pull to get your offices set up. So I hope that you found that of benefit. Dr. Patty, anything you'd like to add before we end the call?
No, it was just good to visit with all of you today, and I hope everyone has a wonderful day. Thank you, Marci.
Thank you so much. Thank you all for joining us today, and have a great day. We'll see you next Thursday. Bye-bye now.
Bye.